I'm Lakshmi Pulakat. I am a professor in the Department of Medicine as well as in nutritional and exercise physiology. I got my PhD in biochemistry from University of Melbourne, Australia, and then did some postdoctoral research at University of California, Irvine, and then came at some point to here in Missouri. And what attracted me here is my interest in the diabetes and heart disease. My area of research is to try to understand how heart disease progress in conditions of diabetes. As you all probably know, heart disease and cardiovascular diseases in general is the number one killer in states. Among diabetic people, again, heart disease is one of the most important factors that contribute to mortality. Women usually have a protection from heart disease because of their hormonal milieu. However, diabetic women, young women, lose this protection. So, I am very interested in trying to understand how does heart disease progress in diabetic patients, how does it happen faster than the rest of the people, and why the mortality is higher in diabetic women. So, this is really the goal of my research. Diabetic heart disease, from the heart disease point of view, may look very similar to the normal heart disease. However, patients with diabetic heart disease usually have a higher mortality rate. When you look the standard techniques such as echocardiography or MRI, you see some parameters that suggest there is cardiac disease, but the severity of it is sometimes not seen from these parameters when you look at a diabetic heart compared to another individual who has heart disease. And yet diabetic patients do have situations such as sudden death more than the normal individuals who have heart disease. So, what I am interested in, and this is particularly true in women. So, what I am interested in is finding out what factors may be playing an underlying role in causing cardiac structural damage. And our recent studies have identified one molecule that is usually associated only with diabetes as a molecule that may be responsible for some level of cardiac damage. And this is what we are following up now. In general, the impact of my research would be to identify novel biomarkers that cause cardiotoxicity in conditions of diabetes, which would have a general larger impact on individuals suffering from diabetes, because if we can identify the progression of disease before it get to a point of heart attack, serious lethal heart attack, that would save a lot of life.